dental laser company called Waterlase. And I've always been impressed that the dentists have been using some lasers in the mouth to cut a lot of tissues that are very similar to ours. And so I just want to give you a little bit of, it's an F7, or function 7. Laser that is used in dentistry worldwide, and it's called a Waterlase. And it's a YSGG laser, but what is unique about it is it mixes with water and has an interesting tissue reaction. And dentists, and you probably have seen this in your community, use this, and they can actually cut hard tissue, they cut soft tissue without anesthesia and without bleeding, which was an interesting thing to me and how it might apply to us. It has a console that you can check all sorts of parameters. You can cut bone, teeth, gingiva, you can vary the power of the laser, the speeds. Also, how it mixes with water is unique, and you can do different types of cutting depending on how you mix the water and the laser. Has lots of different types of shaped fiber optic tips, which we found out, and it's a very cost-effective compared to what we do. You know, the laser's you know, about a $70,000 laser, but the tips are very inexpensive, and it's something that's used a lot in dentistry. It works through photo disruption, and it's a mixture of really the water that makes it unique. You perform incisions, excisions, ablations, variations of different tissues. And a couple of years ago, I kind of told the company a lot of tissues in strabismus, antersegment glaucoma, refractive plastic surgeries that we cut with lasers. So what we set up is a little bit of a lab setting and started looking at what kind of settings we could cut each time. These are pig eyes. And things that we could do, this is actually using it on skin. This is on pig skin, actually, but you can, you know, it's, the plastic surgeons we brought in to do this, they thought this was very interesting tissue cutting, and there's a lot of potentials for it for uses in this particular area. You can see there's a lot of different shaped probes that they use in dentistry, so we've got different probes that we could actually use on the cornea in different ways. And probably the most interesting thing we did, and Mike Stiles, we were playing around with this, who's a glaucoma specialist. What he did was he uses the trabectome. What he did was we were able to take a 100-micron probe, and you could push it right through the cornea, and you could go right through across the anterior chamber, and with a gonio lens, you could remove trabeculum meshwork from the inside with this. It was quite interesting because it was a self-sealing incision where the trabectome has a larger incision, but we were able to do some of these things with it, which were quite interesting. What got me interested in this in the first place, and this is, obviously you know that there's scleral incisions for presbyopia. Waterlase has developed some intellectual property for different ways to do the scleral surgery with the same laser for presbyopia. This is quite interesting because this is Dr. Rodriguez in Spain, just his brother's a dentist, so he just decided to bring this in. I want you to notice how bloodless this field is. I mean, you know, this is something he's cutting through conjunctiva using the laser. These blood vessels are huge in this area, and watch closely with this next little bit where he actually cuts the muscle off. He's actually going to take the laser here and cut the muscle off for a business procedure, and there's no bleeding with it at all. I mean, it's pretty amazing to look at a dry field like this. And these are something that are done with have minimal inflammation afterwards. After he's put his sutures in this there, but he doesn't has been using this in Spain. So I just want to kind of look at this as this is part of this course that Jonathan puts on, and start looking into the next generation. But this is something that's already readily available. We always talk about the FDA running away. Somebody would have to go do some study.